I first met Brent many years ago. I don't even remember how long ago. I met him and I was taken by his wonderful personality, his genuineness. He'll laugh at this, but he reminded me a bit of one of my own adult sons, and just how honest and genuine he was and continues to be. When I refer people to him, I know that they're in good hands. I've been a licensed marriage and family therapist for many, many years, and my specialty is working with children and their families. And throughout my experience here in the desert since 1990, I have worked and assessed children who come to me brought by their parents for oppositional defiant disorder, anxiety, depression, learning disorders, ADD or ADHD, some children who are on what's called the autism spectrum, anything from high functioning autism like Asperger's disorder to more severe autistic kinds of behaviors. And I rely on Brent a lot because many of the children I see need a further workup. Oftentimes I will have some questions and the parents will have questions because we're trying to understand whether the child's problems are based in maybe a more learning or genetic or biological component, or if they are more environmental and learned and perhaps a reaction to what's going on in the family. So often I will refer to Brent because he does an excellent test battery, he provides an excellent report to me and to the family, assists with some recommendations to the school, whether it's public school or whether it's private school, to help make sure that children have the best environment to help them with their behavioral issues and or learning problems if there are any. Parents will call and they just don't really know where to go. They're confused, they reach out for either therapy, they talk to their pediatrician. Some of them have heard about Brent or others for testing and they don't know where to go. So what I try to do is when a family contacts me, sometimes I will refer them to Brent first if it feels as though what the parent's describing is more of a learning-based problem, because it helps me to rule out if this child is having learning difficulties, then their frustration, their oppositional behavior, maybe their sadness, maybe their anxiety is really based in that. So then we have a better framework to understand how to be able to help them and we can all work as a team. Sometimes I start out with the family and I meet with the child and I notice some behaviors that concern me, or I want to have a confirmation of a diagnosis that I'm looking at. And sometimes diagnoses and the symptoms are very clear, and sometimes they're not. It's not an exact science. So I will make that referral early on to Brent. And the reason that I make it to Brent, there are some other psychologists in town, and there's some that do a very fine job, but Brent is the one that I know does an excellent job in testing and assessing young children. So when I send them to Brent, I know that he will respond. Again, I know that he provides a very, very thorough evaluation, a very thorough report. I've never had a parent come back to me and say they weren't content with the services. He's an educational psychologist. He has the expert ability. He has the training. There's training that I have as a licensed marriage and family therapist, and then there's training that he has. Some of it perhaps overlaps, but a lot of it is different. When I refer someone to Brent, it's not just because he does a good job and we're going to find out the child's IQ and learning strengths and areas of weakness. It's also to help me formulate an appropriate diagnosis, because a lot of times in children especially, symptoms are very similar. Child presents as very anxious, and then I learn they're hyper, they're all over the place, they're oppositional at home, they're not listening to the teacher, and that could be anxiety, could also be ADHD. It could also be related to other things. So by having Brent do some testing, doing age-appropriate interviewing and testing, I can then learn where the symptoms lie on, say, this continuum, which could be from one issue, anxiety, to say perhaps ADHD. Even in some cases, we're seeing younger children, even with bipolar disorder. And so Brent can help me as a clinician be able to look at what is the most appropriate diagnosis that conforms also to what I am seeing, and it assists me then in providing a good treatment plan for the child and the family. What I know about him and what drew me to him when I first met him, and I know a lot of people in the desert, and I've been out here a long time, and I've been in many different venues, from mental health to running an agency in Indio to teaching for years and years at College of the Desert and at Brandman, which is part of Chapman University, as well as being in private practice, is that there's some people that just stand out as being just lovely human beings. Brent, I think, goes the extra mile, and what I liked about him the first moment I met him was he's humble, he's thoughtful, he's really more interested in other people than himself. So he's very complimentary, and he really likes working collaboratively. And the only other piece I'd add is he's just an awesome guy. I just really like him.